Okay, Dr. Kasmani, it's been a quite the ride this week. Give me an idea, like we talked last week at this time, what's gone on from your perspective at KFL&A in the last week?
Well, we've had an increase in the number of cases in our region. We now have 14 cases in our area. As far as I understand, everybody is doing well. They're either isolating at home, or I think there was somebody who was in hospital, but they were doing very, very well as well. And so that's the good news. Besides that, our assessment center is now operating out of the Memorial Center, and there's also an assessment center in Napanee being run, I think, out of the L&A hospital there. So our testing has increased. We have really tested quite a large number of people, I think about 400 to 500, and only 14 in our area have been positive, which keeps our rate quite low, and much lower than many of our peer jurisdictions. I think we were compared to the rate of testing in Singapore per 100,000 right now, and we've seen how well they've done there. So this is something we're looking to keep doing, is to keep testing broadly, to keep our contact management, our case management and contact tracing efforts going, to make sure that any little sparks that are out there don't turn into broader outbreaks.
How long do you think it'll be that we get to the point where someone who might be concerned, not necessarily about having been exposed to it, but about their possibility, like those of us in the essential sector who have to go out there, how long is it going to be, do you think, before somebody can say, hey, test me, I want to know?
So one of the things we're doing for our testing criteria is you have to have symptoms, but we have a limited number of tests right now, unfortunately. As we talked about, most of our swabs that we were using are manufactured in Italy, and so because of the issues there, it's challenging to get access to those. So it's not that we don't want to test everybody. If we had access to swabs, we would test everybody we could. And so what we're suggesting is that if you can't get a test, we're focusing our tests on high needs people like healthcare workers, people admitted to the hospital with pneumonia, people who live in long-term care homes or other communal centers. Those are high risk areas for outbreaks. And keeping our healthcare workers means that we can keep them working and not spread the disease amongst healthcare settings. So if you're not able to get a test, what we're recommending is that if you have a respiratory illness or a fever or a viral illness, you stay home and self-isolate for the 14 days, acting as if you did have COVID-19. And that way, if there are people within that group who have the virus, they don't spread it to their loved ones, their communities, or beyond. And so we have been doing some surveillance to see what the presence of some random tests. So everybody who has a pneumonia in a long-term care home or being admitted to the hospital, for example, with pneumonia, are getting that test. And that's our random way of testing people to see what the volume is, or if there's a signal anywhere, I should say.
Okay, so those of us who still have to get out into the public, more than ever, I guess, it's important just to follow the guidelines and the safeguards and to minimize going out in the public. Like if you need groceries, go out once a week.
Exactly. So social distancing, and I think all levels of government are focusing on this. We've seen the Prime Minister talk about it. We've seen the Premier talk about it. We've seen the Chief Medical Officer of Health for Ontario and the Chief Public Health Officer of Canada, all, as well as our local Medical Officer of Health, Dr. Moore, talk about the importance of social distancing. Well, one of the things we've seen with this illness is that a certain percentage of people may not display overt symptoms, and we're not sure what the transmission risk there is. And so by minimizing that contact as best we can, we're then able to have better contact tracing and find out the people who need to be isolated if they get sick.
Okay, one of the things that was on the news this morning was Iceland has been doing a lot of testing because they have a very small population and they're able to get the percentage of tests up in their community. That something like 50% of the people who tested for COVID-19 had no symptoms. Does that reinforce the importance of social distancing?
Yeah, and I think those people, they may be able to spread it. We're not clear of the dynamics of how well they can spread it, but that really does show why it's important to have the social distancing right now while we start to learn more about this virus. We talked about the value of time. The value of time means that we can prevent the spread, make sure that the people who are most vulnerable and actually are getting very sick from this, which we still don't know how to predict, aren't getting sick. And that gives us time to learn more about it. It also means that people who are getting very sick don't all get sick at the same time and don't overwhelm our healthcare system. And then we're able to actually care for people who are unwell and not fall into situations like we've seen initially in China and now in Italy, where their rates of mortality and morbidity are going up significantly because the hospital can't care for people.
Right. Speaking of hospitals caring for people, how is the hospital, like the infrastructure, working? I believe that we've sort of separated the COVID-19 from everything else. I know a lot of elective surgeries have been canceled. How is that holding up so far? The ability of somebody who's got a different kind of emergency to get the care?
Well, from what I've seen, I haven't been working directly with the hospital yet. So, but as we know, there's only been one patient who's been admitted there. The volumes in the emergency department, I think, are, I shouldn't actually say, I don't know exactly what they are, but we know that there's only been one patient with COVID-19, and so their capacity still remains to treat people for all the other things. They are turning down their elective procedures and reducing visits to what's only immediately necessary or urgent or emergent, because if all those other things start coming in and then you get a surge of COVID-19 cases as we're expecting in the future, then the resources may not be available for everything at the same time.
On that note, if somebody is feeling that they might have symptoms, they're concerned, they're worried, we've been drilled into us when you're feeling an emergent situation, you dial 911. Should people not dial 111 at this point and use the other mechanisms? And if so, what are they?
Well, if somebody is feeling acutely short of breath, unable to breathe, if you're not able to take a couple of steps, if you're having that symptom or that chest pain, the tightness, slurred speech, or an emergency, you need to call 911 anytime you have those, or if you're in any sort of emergent situation. So I would say that if it's something that needs a 911 call, that should proceed. If you're at one of the risk factors, if you've recently traveled or if you've come into contact with someone who has COVID-19, or if you have yourself had COVID-19, you need to let the EMS know so they can wear the protective equipment and not end up getting and spreading the illness as well. But other resources, if you're feeling well, if this is like one of the other illnesses you've had, you're feeling well enough and you don't feel like you need to go into the hospital, as we were saying earlier, you can self-isolate. You can call your physician. You don't have to go in to see your physician, but you can call them and ask them for advice, or you can call Telehealth Ontario. The Ontario government website, ontario.ca/coronavirus, has a really good new online tracking or assessment tool that will give you advice as well. It goes through the various symptoms. But if you're feeling really acutely unwell and you think it's an emergency, you can still call 911.
That's good information to have. Just what are some of the other numbers? I know telehealth, it's 1-866-797-0000. We'll have that up on the screen here. Is there a local line people can call, KFL&A?
Well, for KFLA, we would encourage you to go to our website, kflaph.ca, and there's good information there in the Ontario website. As I was saying last week, our volume of calls has gone up significantly, and so the wait time is quite long right now to get a hold of somebody on the phone. So if you go to those two sources first, you'll probably get the necessary information, and if not, there's different ways to contact us on the website there.
Okay. Going back into the news, and it seems to change on a daily basis. New cases were reported today, apparently, you can clear me on this, that were community transmission in Kingston. Is that true?
Right now, there's 14 confirmed cases that I know of. The majority of them have a documented relation to travel or a close contact with somebody who is positive. And there's a couple that we're still working on for case and contact management, as I was talking about. So calling people, looking at their circles of contacts and seeing that. And we're still determining the source for, I think, 3 of them at this time.
Okay. Now, those watching at home who may have relatives coming from abroad returning to Canada, I'd like you to repeat something that needs to be repeated again and again and again, I think, and that is, if you're coming from the airport, do not stop and get gas, do not stop and get groceries, go straight home and then figure it out from there. Could you please repeat that again? We can't say it often enough.
Yeah, and so that's a very important point, and thanks for bringing that up. As far as I understand, the federal government is now enacting the Quarantine Act, and so that is federally legislation that you must go straight home and isolate at home. Everything else can be figured out afterwards. That's for 14 days. I must admit, I just saw the news story before I came, so I didn't see what the penalties will be if you break the Quarantine Act. And so I'll have to get back to you on those. But I would not stop for groceries. I would not stop to see friends. I would not stop to pick up the dog from the kennel. I would not stop to do, drop off the RV for a clean. All the other things you may do on your way home, you have to avoid. I heard Premier Kenny from Alberta saying a list of different things that people were doing. And it's really important to just go straight home and isolate at home for 14 days. If you're feeling unwell, don't take public transit to get home either. You have to take a private vehicle. If you're coming back to Canada from abroad, including the United States, you have to self-isolate at home for 14 days. That means no leaving the house. You're not allowed to go for walks or go outside. You stay home. You can use a grocery delivery service or have somebody deliver groceries to your front door. But you can't leave the house. If you have a medical appointment, you have to call and reschedule that, unless it's something that cannot be rescheduled and is very important. Then you can talk to your healthcare provider. If you work for a critical service, you should talk to your employer and your occupational health and safety department when you come back. The number of people in that group should be limited because people aren't leaving and coming back at the same level they were before. Everybody else should be practicing social distancing. So the way Dr. Moore likes to describe that is keep a hockey stick length between you and everybody else around you. If you're going out for a walk, which we encourage, get out there, get some fresh air, get away from the news and everything. Make sure that you're not in a group situation. You have that hockey stick distance, and you're keeping your space to yourself as well. We're encouraging people to avoid groups greater than 5 people, especially to limit that. That means no more dinner parties, coffee dates, and all the other things we're so used to. And the important thing to remember is the sooner we do this, the lower the spread we have and the less time we have to do this for. So this is not easy. There's a lot of challenges associated with it, but unfortunately we're in a pandemic, and in order to get through this and get through this with the least number of lives lost and the least amount of damage to our livelihood, we have to start early and be aggressive so we can lift these measures earlier and return to normalcy as best we can.